Welcome. What is flatten the curve? Coronavirus is a socially transmitted disease, and we all have a social contract to stop it. History shows that taking strong steps now to slow the spread of coronavirus will help communities and individuals. While the virus can't be stopped in its tracks, it can be slowed. Stopping it from spreading quickly will help ensure that healthcare systems can cope with the strain of the outbreak. But if everyone gets sick at once, represented in the chart as the sharp uptick, it's a problem. Splitting the chart is a line, the finite capacity of the healthcare system. Above that line, it becomes far more challenging to treat both coronavirus patients and people sick with any other illnesses. That leads to a need to flatten the curve, or slow the infection rate, leaving healthcare systems better placed to treat people and save lives. If you look at the image on right, you can see two curves, two different versions of what might happen in the United States and the world, depending on next steps. The tall, skinny curve is bad. It means that a lot of people will get sick at once, in a short period of time, because we don't take enough steps to prevent the virus from spreading from person to person. Most people won't get sick enough to need a hospital. But those who do could overwhelm the number of beds and care teams that our nation's hospitals have available. The flatter, lower curve is a much better one, but it will take working together to make it happen. Flattening it together helps everyone. If individuals and communities take steps to slow the virus's spread, that means the number of cases of COVID-19 will stretch out across a longer period of time. As the curve shows, the number of cases at any given time doesn't cross the dotted line of the capacity of our nation's healthcare system to help everyone who's very sick. If you don't have as many cases coming to the hospitals and clinics at once, it can actually lower the number of total deaths from the virus and from other causes, he says. And, importantly, it buys us time for university and government scientists and industry to create new therapies, medications, and potentially a vaccine. Another key factor to consider: the doctors, nurses, pharmacists, technicians, and many other staff who actually work in healthcare. The more cases of COVID-19 there are at any given time, the more likely some of them are to catch it, whether in the community or at work. Once they're sick, they need to stay away from patients for weeks, which means fewer people to take care of the patients who need care. The bottom line: canceling, postponing, or moving online for our work, education, and recreation may be inconvenient, annoying, and disappointing. But hospitals need to have enough room, supplies, and staff to care for those who need hospital-level care, whether it's for coronavirus, a heart attack, car crash, broken bone, or birth. That's why it's important to listen to public health authorities and leaders if and when they say it's time to change how we live our lives temporarily. What is flatten the curve? Thank you for watching this video. Goodbye.